Hello viewers, welcome to my channel. Are you thinking about MRCS but not in a position to book the exam yet because you think you are not ready for it? I hope this video will help you. There is something known as analysis-paralysis and there is also something known as the Dunning-Kruger effect. Both basically mean the same thing. The more you know, the more you realize that there is more to know. So consequently, a more knowledgeable person paradoxically becomes less confident. Now, it is okay to be nervous before MRCS because it is an exam that involves a lot of commitment, both financially as well as in terms of time. And I can understand that you might be in a position where you cannot devote adequate time, and you might also be in a position where you don't have the financial flexibility to take this exam, uh, and considering the possibility that you may not clear it the first time. So these can be issues that can hold you back, which is perfectly understandable. All I want to say is I want to share my own experience. I first thought about becoming a member of the Royal College of Surgeons in 2016. This is before I started my residency in E.N.T. When I joined my residency program, I spoke to a few people and they were all very enthusiastic about this exam. But for various reasons, we were not able to take the exam at the same time. I ended up taking the exam in 2022, a full 6 years later. In one word, this can be described as procrastination, but you can think of it as analysis paralysis also. I analyzed the various aspects of preparing for the exam. I realized I don't have the time to prepare for it, and I also did not have the money for it at that time. So I did not take it. When I did take it, I didn't necessarily have the time, but I made the time for it. What we need to understand here is very clearly that every exam is a difficult exam. There are no such things as easy exams. And every exam, whether it is an English language proficiency test or NEET PG or MS university exam, every exam has the potential of not succeeding. Now, you might say the statistics state that 90% of examinees in this particular exam always pass, but then what's the guarantee you'll not be part of the other 10%? So it is always a question of, do you have the ability to take a leap of faith when you are applying for an exam? For MRCS, a very simple trick that I want to tell you is, if you don't apply for the exam, you will not start preparing. It just does not happen. I'm not saying this from personal experience. I can say this with full certainty that if you haven't applied for the exam, if you haven't booked the exam, preparing for the exam does not start properly. Okay, preparing for the exam may not start properly even after booking the exam due to various factors that may be beyond your control. But if you haven't booked the exam, then you just don't get the impetus to start preparing for it, because for very simple reason, it is a very expensive exam. I think the last time I checked, it cost around £600. You can convert it to Indian currency, and of course, it's an expensive exam. But depending upon your condition, in terms of your academic situation, whether you are an MBBS student or a postgraduate student, or if you have completed post-graduation, you know that you have passed several exams. And you might think that MRCS is tougher than every other exam you have appeared in. But look at it from a different point of view. At some point, you felt that final year MBBS exam was the toughest exam. At some point, you might have felt NEET PG was the toughest exam. But you cleared all of that, didn't you? Now, if you're asked to take NEET PG again today, having cleared it, you will still feel it's tough. But it didn't stop you from taking the exam, did it? My point is quite simple. Every exam is tough, and the toughest exam is always the next exam that you're about to take. The exam that you have passed becomes relatively easy in retrospect, and the exam that is impending is always something that you're not very confident about. So it's okay to be nervous, it's okay to have doubts, but if you don't apply for the exam, you're not going to pass it. So, of course, if you apply for the exam, there is always a possibility of not passing. That is definitely a concern, and the exam is expensive, acknowledge that. But if you don't apply for it, how will you pass? Now, a question that I've encountered quite frequently on my social media is, I don't know anything about MRCS, I want guidance about it. So just let's start from scratch, okay? MRCS stands for Member of Royal College of Surgeons. So at the very outset, if you want a career in the surgical branch, you can consider pursuing MRCS, even after MBBS, because the only eligibility criteria is having an MBBS degree or a primary medical qualification from a medical college that is included in the World Directory of Medical Schools. You can check if your medical college is part of the World Directory of Medical Schools online. It's a simple search. So that's the first thing. Do you want to be a surgeon? If you want to be a surgeon, then you can consider MRCS. MRCS stands for Member of Royal College of Surgeons. There are 4 Royal College of Surgeons, 1 in London, 1 in Glasgow, 1 in Edinburgh, and 1 in Dublin in Ireland. Okay, so Dublin is in Ireland, London is in England, of course, and Glasgow and Edinburgh are in Scotland. Now, there are 2 parts of this exam. There is MRCS Part A and there is MRCS Part B. If you are taking it from the general surgery point of view. If you're taking it from the ENT point of view, then there is MRCS Part A and MRCS ENT OSCE. Okay. Now, for general surgery, both parts, MRCS Part A and Part B, can be taken from India. For ENT, however, as of recording this video, only MRCS Part A can be taken from India. MRCS ENT OSCE needs to be taken from the UK or in Ireland. There is an easy method of predicting the venue of MRCS ENT OSCE in UK or Ireland. I have made a video about it. You'll find the link to it in the description below. So let's assume, like me, you are also pursuing MRCS from an ENT point of view. MRCS Part A is a multiple choice question exam, consists of 2 papers. Paper 1 has 180 questions, is of 3 hours duration. Paper 2 is of 120 questions, 2 hours duration. Each question has 5 options. You have to select the single best answer. There is no negative marking. Both papers happen on the same day. First the 3-hour paper, then the 1 hour gap, and then the 2-hour paper. So you have to be able to concentrate for 5 hours, almost at a stretch. Okay, so it's quite difficult. This includes the entire general surgery syllabus, orthopedic syllabus, microbiology, anatomy, physiology, and a few legal and management aspects of medicine in the UK. I have made a detailed videos about how to pass MRCS Part A. You'll find the link to it in the description below. For MRCS ENT OSCE, there are 2 parts again, the non-manned exam and the manned exam. The non-manned exam tests your knowledge of ENT in simple, precise, OSCE type questions. They just ask you a very simple question which has a very specific, unambiguous answer. So you have to answer in a precise manner. In the manned exam, you have to communicate with the patient, either obtain history or break a bad news or obtain informed consent or explain the disease and its complications and its treatment options. And you might also have to perform a clinical examination like ear examination or nose examination or flexible nasoendoscopy. So this is roughly the what the components are of MRCS. Each exam, the MRCS Part A and MRCS ENT OSCE, needs to be booked separately. And of course, you can only book MRCS ENT OSCE after passing MRCS Part A. In order to pass MRCS Part A, you get 6 attempts. You cannot take more than 6 attempts to pass MRCS Part A. For the second part, you get 4 attempts. And you have to complete the second part within 7 years of passing MRCS Part A. I hope I have been able to explain this properly. I have made detailed videos on each step of this exam, and you can find those in the description below. Moving on. So what is the way to prepare for it? Preparing for MRCS Part A is almost like preparing for NEET PG. That is your postgraduate entrance exam in India. Okay, so you have to study the subjects I mentioned. General surgery, you need to know in detail. You need to know orthopedics. You need to know anatomy. You need to know physiology, and you need to know pathology also. You need to know a little bit of microbiology, and you need to know some management and legal aspects of how medicine is practiced in the United Kingdom. Because after all, this is a United Kingdom based exam. There are various coaching programs to prepare for it. There is one by Dr. Sala, which I did not take, but I have heard very good reviews about it. You can read from textbooks for general surgery, that is Bailey and Love or Sabiston, and orthopedics is Maheshwari. You can, and for basic sciences, there is a book by Andrew Raftery. So you can choose the textbook method. I did not choose any of these methods. My method was I took an online subscription from EMRCS and I took an online subscription from PASTEST. PASTEST had great anatomy videos, anatomy lecture videos, which with dissection, and it really helped me understand anatomy very well. And EMRCS questions are almost identical to the questions that are asked in the actual exam. So I prepared using these online subscriptions for about 6 months. I feel 6 months is adequate time to prepare properly for MRCS Part A. Once you have passed MRCS Part A, it is of key importance that you don't wait too long to apply for the next part, because if you wait too long, you allow doubts to creep in. Okay, go with the flow and then just apply for the next part, whether it is general surgery or it is ENT, depending upon which is your area of interest. If you are an MBBS student and you don't have experience of post-graduation in general surgery or ENT, then tackling the second part might be slightly challenging. What you should do is, while you're preparing for the second part, you should try to get junior residency, non-academic, or some sort of shadowing facility in a medical college near you. Okay, or even you can shadow an established private practitioner or a consultant in a subject of your choice and just shadow the person. You will figure out many of the things that are asked in the second part of MRCS. Now, I think I've been able to guide you. If you had no idea regarding MRCS, I think this is something which will help you. The other question that I have encountered quite frequently is, I don't have any intention of working outside India. Then why should I take MRCS? Now, here the answer is quite simple. Even if you don't want to work outside India, if you have taken MRCS and you can use the post-nominals MRCS after your name, along with the other degrees that you might be having, like MBBS, MS, DNB, MRCS, that adds a little bit of glow to your CV, for lack of a better word. It adds a bit of shine to your CV, and it is always a good thing to have a little bit of more in your resume. Also, if I have to go beyond the superfluous stuff, the experience of taking the exam in UK and clearing it does open your eyes, does expose you to how medicine is practiced in a different country. And you realize the similarities and you also realize the differences. What the similarities tell you is that your training in your home country is at par with training in what we call developed countries. And the differences that you encounter may be positive differences which you can imbibe in your own practice and improve. And there can be negative differences also. And that's something you can also be aware of. So it basically broadens your horizons, is what I'm trying to say. So even if you're not interested in working outside India, it is worthwhile, if you can financially afford it, to consider MRCS. Now, another question or another set of questions that I have encountered by people who are convinced, who have prepared, who have passed maybe some part of the exam is, will I get a job in the UK after passing MRCS? What kind of a job will I get? Will there be growth in my career once I go to the UK? Will I be discriminated against? What happens to my family in India? Now, these are questions that is very difficult for me to answer on your behalf, but I'll try to nevertheless. First question, will I get a job in the UK after MRCS? Now, I can't guarantee that. I am not the employer in the UK. But of course, if you don't pass MRCS, if you don't get the GMC registration, if you don't prove that you are proficient in the use of English by taking an English language proficiency test, again, all these steps have been explained in detail in different videos that I have made in the last few months. You'll find links to it in the description below. Now, if you have completed this process, then you are eligible to apply for jobs and you are likely to get a job. But nobody knows for certain when you will get a job, what kind of a job you're going to get. Nobody knows that. The only thing that I have learned in my journey, MRCS journey since September 2022, is you need to be patient. It takes time to prepare for the exam. You need to wait for the results to come out, which is excruciating, that wait. Then you need to prepare for a second part, which again requires time. Then you go there, you take the exam, again wait for the result. Then you go and take your diploma, prepare for the English language proficiency test, apply for GMC registration, verify your documents, get GMC registration, and then you start applying. And again, applying for jobs does not mean you get it in the very first attempt. The mean or the median wait time from applying for the first time to getting your first job in the UK is about 7 months. But I don't see why you will not get a job, because you have passed MRCS, you know E.N.T, and you have proved your proficiency in English. So the NHS is the fifth largest employer in the world, and they are always looking for new doctors. So I don't see why you will not get a job. Now, the next question is, what kind of a job will you get? Now that depends upon your experience. And of course, if you are applying for a job after MRCS, you are eligible for what the UK people call ST3 equivalent jobs. That is the third year of specialist training equivalent jobs. For simplicity's sake, you can think of it as a middle grade job, which is similar to a senior resident or a junior faculty member in India. Okay, so it's a middle grade job that you're likely to get. You can also get specialty doctor jobs, which are non-training jobs, where you will largely be working as a specialist, but you will not have the official designation of a consultant. In the UK, to get the official designation of a consultant, you need to pass FRCS. Now, FRCS is not the same as MRCS. I've made a video about FRCS as well. You'll find a link to it also in the description below. So this is the kind of job you're likely to get in the UK. And you might have to wait up to 7 months to get the first NHS job after you've started applying for it. Now, will there be growth in your career? This depends totally upon your performance and where you are working. This I cannot answer for you. I know many people who have grown, who are now in positions who are now consultants, who are not people who you would consider, I mean, these are people who are stalwarts in E.N.T, okay? And they are now in positions of authority. So they have grown in their career. If they have grown, why would you not? So it's very important to not inhibit yourself through your own thoughts. And we often are guilty of doing that. So if there is growth or not, that totally depends upon your effort and your circumstances where you're working. And let's be optimistic. Why will there not be growth? I have seen growth in the career of other people. Why would there not be growth in your career? As for discrimination, I don't believe that discrimination is as widespread as we think of in the media, but discrimination certainly does exist to an extent, and I have seen it in YouTube comments, if not anywhere else. But I've had the experience of visiting UK more than once, and during my visits, I did not encounter any discrimination at all. People were unbelievably helpful. And they were actually suspiciously helpful. I've never seen more polite people anywhere in the world as the ones I met in Glasgow. So my experience in the UK have always been very pleasant. So I don't think discrimination is as big a deal as we kind of feel when we are far away from the UK. So that's another thing. Another thing is what happens to our family. So this is something which again you have to understand based on your own individual circumstances. All I can tell you is, when we live in India, are we always living with our parents? If we are not living with our parents, are we living in the same state? Are we living in some other state? How much time does it take for us to reach our parents or our other people in our family when we want to reach them? Usually it takes about a day, and it's the same time from the UK as well. Of course, the cost is different because a flight ticket from UK to India is, of course, more expensive than a flight ticket from one part of India to another. But in terms of time, it usually is the same thing. Of course, if your own situation does not permit you to leave your family in India and go to the UK, then that's definitely something I respect. But family, you can, of course, adjust accordingly. Because to be really honest, even in India, do we always spend all our time with our family? So that's something also worth considering. So I hope I answered many of your questions, and these are the questions that I am bombarded with almost on a daily basis on social media. So I thought I should make a video about this, answering this question, and I'm sure many people will still continue asking me these questions, which are always welcome. I feel privileged that you ask me these questions, and I'm always happy to get back to you. Take care, bye bye, and please don't forget to be awesome. Bye bye.